So here today I'm talking about wanted to elaborate on a voice recording that I'll play at the end of this video I did in October 2021. And I bring this up when we talk about taking care of ourselves. Sometimes we have caregivers that are focused on taking care of their loved ones and taking care of other family members or other, however you take care as a provider, a caretaker. And sometimes you forget about, or you just do not concentrate on taking care of yourself. And then when it comes time to take care of yourself, there's no one around that is going to take care of you as much as you have taken care of someone else. Sometimes you're here, you got to take care of me to keep me alive so that I can continue to do for you. But then you still don't take care of yourself. So you put all your time and energy into just stellar performance in helping the other party that you take care of. And so with thinking about this, I'm also thinking about when we go to the doctor and we don't know how to advocate for ourselves. Should we listen to everything a provider has to say and do everything a provider says do? Just because they are the provider, they have the degree, they have the education, and they said, take this medication, this is your diagnosis, do this, and that's it. You don't go home, you don't look further into what your condition is or other ways to help yourself, help you. And another thing is, I remember someone saying, I felt this way too, where I talked to my doctor and it was as though he wasn't listening to me. He got really upset when I started to ask questions. And you find that a lot as well. So when you come across that, some things to do, just like we're talking about setting boundaries from family members, from intimate partners, from work relation, co-workers, etc. The same thing goes for doctors when it comes to taking care of your own health. It's set boundaries. It's time to be okay with looking for a different provider if that provider is not listening to you, making you feel as though you're not valued and your questioning and concerns does not matter, that you just need to listen to them and don't ask questions. And so I share a little bit of my experience of me going to the doctor and signing out AMA. And I understand when people say you need to be able to take advice. And so when I signed out AMA, the reason it was hard for me to take advice from a person that was like, you shouldn't have signed out AMA. What is wrong with you? Are you crazy? You need to listen to these people and do as they say and take whatever medications they tell you to take. And I'm looking at that person like, it makes no sense for me to explain my reasoning of why I did what I did, because they're not going to understand it. And they are definitely committed to not understanding me, right? And then to top it off, it's not that I don't respect that person because they have a license and I don't. It's that same person that got on me about leaving AMA is the same person I have witnessed with my two eyes treat other people different, treat other people bad, treat their people they work alongside with every day in a very bad manner, a very horrible manner. Treat people that come into that they take care of like horribly. So it wasn't that I was being hard to accept criticism. I just couldn't accept it from that person. And so here's a little bit, here's the voice recording I was talking about that follows this.
If knowledge is power, why not question everything? If knowledge is power, why not question your doctor? I remember hearing in school, no question is a dumb question. If you have a question, don't be scared to ask a question. So thinking about and referring to the medical field, and I'm thinking, why would you tell your child, sit in the front of the class if you don't understand something, if you have a question about something, raise your hand and ask the question, right? So why don't we do that in the medical field? Don't worry about someone calling you a narcissist or non-compliant or anything that you are not. They're referring to you as things that they perceive you to be in their head. But all you want is answers. Before you accept a pill, before you accept medication and have to walk out of the hospital or their office with a suitcase load of medication, and you don't feel comfortable about it? Is it because they have a license and went to school? Yes, I understand that. But it doesn't make the person that you are taking care of automatic silenced. I want to know how it works, how the body works, how the pill is going to interact. Are there other options? Is it possible to get a second or third opinion? Why should I feel bad about questioning my own health? Why should I feel bad about wanting a provider, a doctor, a licensed personnel to talk to me in detail about my health? No, you don't have to be anal and say, you don't have to be anal when you ask questions, just to be asking just because. If you legitimately are curious, if you legitimately want to know how certain medications are affecting your body systems, why not ask the question? Why listen to licensed personnel say, you're crazy, just take the medication? Not I. I'll give you an example. I knew I had a cardiologist that's going to be a keeper. So we were going through the questions and back and forth dialogue, and I said, I heard there was a new study for the baby aspirin. He said, I know where you're going, and the study says, and he gave a detailed description of the new study of the baby aspirin to let me know he knows what I was talking about, and he knows his shit. Yep, he's a keeper. He wasn't arrogant. He listened attentively. He showed compassion. Wasn't rushed. That was the biggest part, showing compassion. You care about what you're typing or you're writing for me as a patient. You're a keeper. I understand routine. Well, this is what we've always done. This is how we do it. You have to accept that. But my thing is, are you updated on, do you read once you got your degree on new medical journals, new medical studies? What are you doing every day to educate yourself even more to help your patients? Are you stuck in a rut, continuing always, it's just the way it is, routine? Scared to step out of the box because it's routine. Each and every one of us can do better, can be better. Patients are not the enemy. Patients are dying faster than they. Sometimes you can help intervene that. Patients are not your enemy just because they do not hold the license that you hold. Don't run around looking for a patient representative or a patient advocate. Become your own patient advocate. You go home and have to live in the body that you carry around every day. You lay down that body, you wake that body up, get that body up, you take care of that body. Why can't you answer questions about that body? Yes, some medications are necessary to live for life. Start doing your own homework and research and figure out what are good quality questions to ask a medical professional about your health and your body. Do your homework. Yes, you will have people with, I don't know what to call it, how they think, and they'll look at you like, who are you? Who do you think you are to question a doctor, to question someone that has very many years of authority? Who are you? Why would you question them? This is my body. If I can't question you, if I can't get answers in addition to the answers that I try to find, why would I continue to go to you? Why would I accept your recommendations? Asking questions is not bad. Asking questions get you to clear your mind and make you feel better about your decisions that you accept someone to make regarding your health, your body. Why is there something called patient rights and responsibilities? Don't we have a right? Don't we have a responsibility? I don't see anywhere in patient rights and responsibilities where it says, shut up, be quiet, do as the medical professionals say, don't ask any questions. It's also very important to learn when you pick a doctor, what is their communication style? How does the energy feel with you, and being able to communicate with them so that when you let your guard down and be comfortable, you can you want someone that you can trust and feel good about, someone that you know is honest and also do their homework and is up to date. That is not just stuck in some routine that they're used to and just will not accept questioning without it being perceived as an attack on their character or their license or the way they handle their patients. The outlook on this would be the topic leaving against medical advice. Leaving against medical advice, AMA, is never a good idea. However, it happens quite often. And it's the patient's right. Some medical professionals say, just let them go, you know. Let them know that they can die when they walk out the door. Just let them go. Don't bother with it. And as far as a patient, there are many different reasons why a patient will leave AMA. For me, I mean, it could be things like, you know, someone is not rubbing you the right way, for lack of terminology or a lack of a good way to explain it. I'm trying to think. Okay, here it is. So for me, once I received when I first got to the floor to be admitted, I do understand, you know, doctor put in orders, there's routine, but I was not in agreement with some of the medications that they were giving me that was routine because, for example, Docosate. I have no problem, you know, with going to the restroom. I didn't feel as though I needed that, and I did not want that. Lovenox, I didn't have a surgery. I wasn't laying in the bed for a while. I was just on a 1-day, 24, 48-hour observation unit. And so to inject me with Lovenox to prevent blood clots, you know, I didn't see the purpose. And then also I did take for example, the baby aspirin, because I can see what no one came and talked to me about, my heart monitor just going crazy, my rhythms on the heart monitor. So that's one thing I accepted. Traveling around the world, working in the medical field, I've seen and witnessed nurses getting fired and I've seen them give the wrong medication, pushing wrong meds and things of that nature. So I just wanted to establish I am aware. So I said I will take a picture of the pill because the pill has a number on it, and I can look, you know, the number up to make sure that it is the correct pill that you say you're giving me. But then I had all of my treatment done, besides the lab work, the imaging, ultrasound, CAT scan, MRI, such a wonderful workup. And things were coming back. And after the last one, the MRI came back negative, the nurse said. And she said, it's just probably a complicated migraine. So I'm like, why am I here anyway? I mean, yes, I wasn't feeling good. Yes, I knew I needed to go to the doctor, but a complicated migraine. And then the ER doctor said, possibly West Nile virus. He mentioned West Nile virus twice. And so, but to watch, you know, the leads that are attached to my heart, my body, and watch the rhythms on the cardiac monitor, and then watch my blood pressure, which is normally under 120s over 70 something, go all the way up to 178 over 113. And like the ER doctor said, it's viral. Something viral is making your system go out of whack. And it's like a fight and flight type deal. So once I got everything done, you know, just watching the staff while I was eating. So the doctor put in a regular diet for me. I didn't think too much of that. and the health tech runs while I was eating with the urine cup and said, I need a urine right now. I need a urine. I need a urine. And so I said, okay. So they want to make sure and see if I'm on drugs or not, because in the air, working in the emergency room, you definitely want to rule that out because of the high population of people that come in on drugs. So I stopped eating and I was like, let me give her this right away, so they'll know they're not dealing with someone that is on drugs. So also a few of the nurses would come in and say, where do you work? And I would just tell them, I work at McDonald's cleaning toilets. And it's like, what part of that is important or not? I remember working in the military, in the military hospital, and one of the doctors said, you treat everybody as command interest, because you never know who comes through the door, right? So I've always, in regardless of what positions I've held and dealing with people throughout my life, I treat everyone as though they are someone special, And you could tell a lot of times I have been on the floor and they say, oh my, that's Colonel, or that's Colonel so-and-so, that's Lieutenant Colonel, blah, 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 or that's General such and such. It's like, so now you're going to act different because you know that is a patient of status, a high profile status. You stay out of trouble if you treat everybody the same, right? So that bothers me. That really does bother me. I know also working in Germany at Landstuhl Regional Medical Center, somebody came in and said, let the doctor know that such and such is here. He was a high-ranking officer, and the doctor came out and she said, you tell them I am with Private such and such, and I'll be with him when I'm done. That stayed with me forever, right? She stood up, she stood strong, made her point, and went back in her room and closed her door. So I am a firm believer in treat everybody with dignity and respect, regardless of their title. Because that tells me when it comes time for you to do chest compressions and save a life, you're not going to run into a body that's labeled as homeless or drug addiction, or someone that is not a higher profile person, or someone that is on your level as a doctor or a nurse or something like that, and do all that you can do during a code or a crisis. I don't want to be around you. So anyway, everyone's asking, why did you sign out AMA? So some people, sometimes it doesn't even, it's not even worth my time to give you my thoughts and reasoning for, in this case, signing out AMA. Because you won't understand, you will judge me, and place your label on me. So I knew what I was doing. I knew there were risks. So I went in and I signed out AMA, and right away when I got home, because I knew there was a problem, for me to be admitted. I think this is my first admission. It's 2021. I was only other time I was admitted when I had my last baby, and I had a tubal ligation. Just had my tubes tied, and I was admitted for a day for that. So, number one, yes, being in the hospital is difficult for me, to just be in the hospital. That next day, I was just ready to go. So I got home, and I said, all right. I thought about all the tests I took, thought about the nurse saying, you still have to see the neurologist. And what she said is probably a complicated migraine. And you would need to get the spinal tap to narrow it down for West Nile virus, etc. So at home, I started calling around. I said, now I have to do my part in my health, for my health. Because normally I would ignore my health. I'll find out once every few years. I'll get some baseline work, lab work, and see where I'm at, which is like 18 months ago. I found out I was pre-diabetic and had my bad cholesterol was high. And so the doctor I saw was like, I give you 6 months to correct it, if you don't want to go on some statins right now. And I did. I dove in hard and learned still trying to learn how to eat different and eat to try to help with whatever diseases I have. So back to being at home, I called my personal doctor, and I said I need an appointment. I just left the hospital AMA. They gave me an appointment so that we can go over everything that happened in the hospital, and I can get recommendations from you. And then I called the cardiologist because, like I said, the rhythms that was going out of whack on my heart monitor, and so they took me right away. The hardest thing was to get a neurologist. I still haven't found a neurologist yet. So I went to the cardiologist, and he's someone, I felt comfortable with him right away. And especially after he opened his mouth and started talking, and the way he listened to me and the way he responded to me. So one of his questions, of course, is, why did you sign out AMA? And I said, I want someone to sit down with me, not just hand me medication just because it's routine, to sit down with me, explain what was in my labs, what was in all the tests that I've taken, and before you make recommendations, look at it, and then talk to me about the recommendations that you made. The visit went very well. He recommended that I wear the Holter monitor for 3 days, set that up on me. And again, my bad cholesterol was high, and he recommended that I, instead of taking the statins, he recommended the red yeast, I forget what it's called, red yeast something. And he explained how that particular medication is inside of one of the statins, or the statins. And he said, I recommend that you try this first, and we'll see in a certain amount of time if it's going to make your cholesterol go down. Because he said, me as a cardiologist, that's one thing we're going to attack, because it's final that I had looking at everything, he explained, it points to I had a mini TIA, a mini stroke. Also, he recommended that I stop smoking. I told him I'm ready now to stop smoking. And my primary care doctor said that they don't sell Chantix anymore or prescribe Chantix anymore. And he said he didn't know about that, but he found out they do. So he wrote it for me. And then we got on the topic of the baby aspirin, and and I said I was aware of a new study, and he knew exactly about that new study and explained and how it would or would not affect me. And he recommended that I start the baby aspirins ASAP, and why. And then he, as we talk, and he was writing and his recommendations of what to do, and mentioned about the Charlie horses in the leg, and said, you can get some, I recommend some magnesium oxide, and the magnesium for that. And he explained why the Charlie horses, or why the muscles are doing what they're doing, which caused, I don't know, he just explained it very well, very, very well, and in detail. And so that fits my personality and puts me at bay, at ease, to say, okay, and listen to his recommendations. I'm very happy about that, and I'm excited about looking and learning more about my health going forward. And I'm looking at it like, many people be like, oh my God, you was in the hospital, or oh, that's so sad. Oh my God, you got to take care of yourself. No, I look at it like it's exciting. I'm getting ready to learn about my body and the different diseases that come about, and how can I correct the things that are wrong within my body. I'm not dead yet. And it's like, why not? Why not question what's going on with my body? Why not make it exciting to figure out how to heal my body? And another thing is, I've only been eating different and learning to eat better, mainly plant-based foods, within less than 2 years. So I've been living for 50 years not knowing about eating and damaging my body with the drinking, and not exercising as much as I should, moving the body, and then family history. So now, to learn all this, it's not sad. It's not, oh my goodness, lay down, take it easy, take off work. No. I understand all that, but I'm not going to sit around and mope in sorrow. I'm going to take a step in improving, and it's going to be exciting for me to learn, and not just say, can you give me some pills because I have an ache over here on the left side, and can you give me another pill for the ache on the right side? Can you give me a couple more pills for the ache on the front of the body? And actually, I need quite a bit more pills for the ache on the back of the body. So that's just how I see my life and advocating for my life and my body.
So at the end of the day, to be honest with you, there is good, there is bad, and there is ugly no matter what. Whether we're talking about people, regardless of their positions, whether we're talking about beliefs, regardless of what they are, there is good, there is bad, and there is ugly no matter what. And also, do not be afraid to advocate for your health. Do not be afraid to ask questions that you have concerned about when it comes to your individual health. You can do it in a way with dignity, respect, without getting upset. And if no one respects you, it's time to, as they say, set your boundaries and look for another physician. And there is help for you if you feel as though you cannot advocate for yourself. That's why they have something called patient advocacy or patient representative, and they can advocate for you in your healthcare needs and be like the third party to help get things done and just put you at ease and make you feel better as far as your concerns in your healthcare.